Okay, hello and welcome to our 42nd seminar of the Centre of Research Excellence in Aphasia Recovery and Rehabilitation. I'm Dr. Sonia Brownset, a research fellow here at the Aphasia CRE and co-facilitator of the seminar series along with John Pierce. Firstly, I'd like to acknowledge that this event and many of our participants today are located on the lands of the traditional custodians in Australia. Today, I'm speaking to you from the land of the Turrbal people. We pay our respects to elders past, present, and future, and extend this respect to any First Nations people joining us online. Today, we're delighted to have Professor David Copland joining us from the University of Queensland at the Queensland Aphasia Research Centre. Before I formally introduce Dave, I'm going to just briefly cover some housekeeping. If you haven't already done so, please join us as a member of the Aphasia CRE community of practice. We welcome people with aphasia, their family, friends, health professionals, researchers, and organisations to join our Aphasia CRE community of practice. The CRE is also always looking for financial support, so if you do wish to donate, please see our website for details. You can connect with us on social media via Twitter and Facebook, and we now have a blog where you can read all the latest findings and calls for participants. You can subscribe to research blog updates through email, and as always, please feel free to tweet along with today's seminar using the hashtag AphasiaCRE. Please note that this seminar is being recorded for future viewing. The Aphasia CRE's YouTube channel contains past seminar recordings, and today's seminar will be uploaded within a few days. Now, during the presentation, you may have questions for Dave. Please ask these questions by writing them in the question and answer function on the Zoom toolbar at the bottom of your screen, rather than the chat box. Enter your question for Dave at any time throughout the presentation. You'll also be able to see questions asked by other audience members. You can like a question to show those of most interest to the group. At the end of the presentation, Dave will answer as many questions as time will allow. Please reserve this Q&A space for questions only and keep your questions brief and no comments, please. So I'm delighted to introduce our speaker today, Professor David Copland. So Dave is a speech pathologist and professor here at UQ, where he's the director of the Queensland Aphasia Research Centre. He's the co-director of STAR's Hospital Education and Research Alliance and leads the Neurobiological and Psychosocial Predictors program of the CRE and the Cognition and Aphasia Working Group of the Collaboration of Aphasia Trialists. His interests include the neurobiology of language, pharmacological modulation of language, mechanisms and factors driving aphasia recovery, and the development and delivery of aphasia treatments that optimize outcomes. In addition to investigating the impact of music listening on aphasia recovery, in his spare time, he is, and his words not mine, a frustrated musician and Bob Dylan tragic. So with that lovely end, I'll hand over to you, Dave. Thank you for joining us today.
Thank you very much, Sonia, for that introduction. And yes, I did use some of those words. So I'll just check.
We've got your notes now.
That changed?
No.
No, I'll just go back. That better?
No, you're not sharing anything. Yeah. Sorry, everybody. We did practice this beforehand, but we had a few problems, so we thought we'd fix it. Bear with us. Yes, perfect. Awesome. Thank you.
Excellent. Thank you very much, Sonia, for the introduction. And thank you very much to the CRE for this opportunity to talk about the first 4 years of the Queensland Aphasia Research Centre. So I too would like to acknowledge the traditional owners, the Jagera and Turrbal people, and recognise their custodianship of the lands on which I'm presenting today, which is Barrambin, and I pay my respects to their ancestors and their descendants who continue cultural and spiritual connections to country and recognise their valuable contributions to Australian and global society. So there is always a risk of standing at one moment in time and then looking at where we are with all our biases and blinkers on, and then proclaiming we've made it or we've accomplished something. This is fraught and doomed to later embarrassments. So I'm not going to do that today. What I am going to do instead is to talk about what Quark is. There's already been quite a lot of presentations in this seminar series, which have been around the various activities of the centre. So this includes one on the comprehensive high dose aphasia treatment, or CHAT, covered by Jade Dignam, one on telechat, covered by Annie Hill, Sarah Wallace's work on measures and minimum data sets, Kira's work on consumer and community involvement, and also Sonia's tech work in developing Listen In. So today what I'll be doing instead is filling in some of the gaps, but also having what is admittedly quite a biased and one-eyed look back on the last 4 years. And so I suppose I would ask you to excuse some of this as kind of trumpet blowing in some way, but I want to make it really clear that this is the work of others that I now have the privilege of talking about. This isn't a humble brag. My daughter explained to me what they were. I'm just incredibly proud of all that the team have achieved and lucky to work with this amazing group. But definitely would not like to take credit for this work because it's such a team effort. So from the title of my talk and my general dropping of G's in a title, which people might have thought was lack of attention to detail, and outing myself as a Dylan tragic, you might have also picked up on another theme for this talk. And it's actually a wager or a bet that I have with a colleague who shall not be named, but now needs to pay up. So the bet was who could first cite a Bob Dylan lyric in either a paper or a talk. As with most things, this is actually a bit after the trend. So this is following on from this fun-loving bunch of guys from the Karolinska Institute. So these are scientists and Bob Dylan fans. I don't know why they're picking some of these albums, but that's their choice. So they have, over the last several years, been engaging in this idea of actually citing Bob Dylan in biomedical literature, to the point where it has now had articles written about articles that include Bob Dylan lyrics. One here, like a rolling histone. I have no idea what that means. So they actually did a bibliometric citation analysis and apparently examined citation publications, including Dylan, relative to those who weren't. And apparently the answer as to whether that generates more attention is no. But I will persist anyway with this. So Bob Dylan is someone who I have been obsessed with for quite a long time, but I will admit he perplexes me. So he can write songs of great beauty, but I really don't know what they mean. So here's an example from his early days. And occasionally, and I mean, this is over a 70-year recording history, so I suppose we should forgive him. Occasionally he has what might be considered a bit of a miss. So here's another example, less quoted in his canon of poetic works. And this is more in the 90s, which might explain things to some degree. But it's really interesting to note that this is from a Nobel Prize winner for literature. So the great thing about Bob Dylan is generally, while it is hard to understand what he might be saying, this actually means you can put any interpretation you want on this. So peppered throughout this talk, there might be some tenuous Dylan Easter eggs, and it might help if you were born in the 70s or before to pick them up. But this opening stanza here from one of his classics kind of reflects a common theme from early Bob around injustice and the need for change. So it's like a call for arms, a time for action, and to stand up and be counted. And I don't think it's too much of a stretch to think that we also have what could be considered a call for change in terms of our current situation, working in the field of aphasia. So currently, I think we can all agree that outcomes are unacceptably poor in most cases, and we can conclude that there is a real need for change in how we're doing things, and this hasn't come soon enough. So this is one of the things that drove the need for the development of the Queensland Aphasia Research Centre. Here is the vision. It's not quite Dylan-esque, but it's what we're trying to do here. So to deliver solutions that optimise the lives of people with aphasia, and doing this by bringing together people with aphasia, their family members and friends, with all key stakeholders. So including clinicians, researchers, support groups, professional groups, and consumer advocacy groups. And I'd like in particular to acknowledge Emeritus Professor Linda Worrell in the genesis of this. So this is something that Linda and I talked about many a time, and also builds on the work of Linda leading the NHMRC CCRE in aphasia rehabilitation. Some of these ideas did emerge from the activity of worreling, which people might not be aware of, but it's a verb relating to drinking of alcohol and talking about big ideas and having big aspirations around aphasia, which Linda has pioneered. So this is the vision for QARC, and also need to alert you, there is a lot of purple in this presentation. UQ is mad for it, so just to be aware. So the centre is a partnership. So it's a University of Queensland centre that is an affiliate centre in partnership with Metro North Hospital Service, Hospital and Health Service, and it's actually located with the Surgical Treatment and Rehabilitation Service, or STARS, as part of an alliance between UQ and the Health Service. We were very fortunate to have funding from philanthropists, in addition to UQ funding, both in kind and strategic, and also significant commitment from Metro North in terms of staffing speech pathologists who have been delivering new clinical services, including the comprehensive high-dose aphasia treatment program. So our reach, as in the name, is for all of Queensland, but we are hoping to be able to expand beyond that. So we're working closely within Metro North to develop the centre and achieve our primary goals, but our reach is more broad in terms of Queensland. So Quark is located in the new STARS Hospital at Hurston, so near Royal Brisbane Hospital and Queensland Institute for Medical Research, Berghofer. And it includes rooms for aphasia groups, individual therapy rooms, tele-rehabilitation suites, and facilities for things like EEG, transcranial magnetic stimulation, transcranial direct current stimulation, and also access to the Hurston Imaging Research Facility, where you can get MRI scans and PET-CT scans. So we're very fortunate to move in at the commencement of this building. Some people suggest it's like working in a fancy hotel you can't afford to stay in, but it also has all the challenges that we know are common to hospitals, such as parking, but has wonderful public transport. So the objectives of QARC were firstly to develop a designated centre that meets the needs of people with aphasia and their family members. In a related sense, we were tasked with developing and delivering effective treatments for people with aphasia in hospital, in the community, and in home settings. And a big focus has been finding ways to maximize access to these aphasia services, and in part doing this by enabling access to technology as a way of increasing access overall to treatments. It's also a key objective to develop a platform that allowed increased collaborations between clinicians and researchers in aphasia, and to provide support for student training and education for health professionals as well. So the key deliverables for QARC include this idea that we are developing support and services for people with aphasia, family members and friends. So this includes the idea that there might be consultative technology service, there might be workshops and seminars and social networking opportunities, but also support for clinicians in terms of training, resources and education, and opportunities for students as well in both clinical and research settings. So Quark was established in 2020, and so this included some feasibility studies around some of our key activities, including the comprehensive high-dose treatment and the commencement of a number of other key projects. Then the hospital we moved into early 2021, and this aligned with the commencement of the chat implementation. So this was implemented by and in partnership with the STARS Hospital, also opening of a tech hub and commencement of workshops and the live chat program. Then the capacity of the hospital has increased in terms of patients coming in, and we've also reached a number of milestones in terms of the different treatments that we've been developing. So this is when we first moved in, a bunch of spring chickens there who could probably all fit in a Tarago, which I think is a good way to quantify researchers. And then we've grown over the years. So this is possibly more a minibus. And then finally, so there's a large cohort now, or a large touring bus. And it's been wonderful to see the growth of the centre, including across many disciplines. So from speech pathology, engineering, computer science, linguistics, neuroscience, psychology, music therapy, mathematics and law. And so this provides an amazing basis for thinking about aphasia and what we should be doing in quite a different way. It's also a very good advantage for pub trivia dominance. I'd also like to call out here that there's a lot of collaborations that have gone on, and our capacity has been enhanced a lot through partnerships with the NHMRC CRE and also through funding through a number of MRFFs as well. So the structure of the centre was initially around particular flagships. So this is as a function of the philanthropic funding. This was developed in consultation with the donors over a round of different pitching sessions and meetings, which were kind of cross between the Shark Tank and The Voice and an NHMRC panel. But the donors were incredibly thoughtful and insightful about what areas we should be supporting and how we can then demonstrate impact. So while this was the initial focus, it's really important to note that as we've grown, we have a number of researchers and research students who are developing and leading other research projects outside and in addition to these flagships. But initially, this was the focus. So it was around co-design of aphasia services, implementation of comprehensive high-dose aphasia treatment, both the face-to-face version and also via telerehab, the development of the aphasia tech hub, minimum data set development, and also looking at neurobiological predictors of recovery. So when thinking about Quark and what it is and how we're going, an international perspective can be informative and helpful. So Bridget Forrester is a former honours student, along with Lisa Animet, Marie-Pierre McSween, Sarah Wallace and myself, have recently been conducting an international study of aphasia centres, looking into what their structures are and what factors are associated with positive outcomes and sustainability of these centres. So I'm going to show a few key findings of this work and then relate these to Quark to see how we're going. Are we on the right track, or are we barking up the wrong tree or doing things differently? But to give some context. And so the structure and operation of aphasia centres, as you can imagine, is quite varied, particularly in terms of capacity. So the dose of therapy or services provided ranged significantly. Organizational structure, so the involvement of different disciplines varied a lot. So in quite a number, there were inputs from psychology and occupational therapy, but this wasn't uniform across all. But also volunteers were often involved as a part of the staffing profile. In terms of ways into these aphasia centres, there are a range of different referral pathways, so including self-referral, and then from speech pathologists, allied health and medical professionals. There were a range of supports that were enabling these operations for the centres. So this includes philanthropic donations, fee-for-service systems, and various government bodies. So internationally, this varied quite a lot. And the scope or the span of the centres varied. So often they would have a focus on a particular region or county, but sometimes it was broader to a state. And also this had changed with focus on teleconferencing and telerehab. So in terms of culture for how these aphasia centres are operating, one key feature which was evident across almost all centres in the survey was consumer involvement in decision-making. So this included completing regular service evaluations, sitting on boards, including boards of directors and advisory groups and steering committees. So this is one key thing that we have been working on as well here at Quark. And I'd like to acknowledge the work of Kate O'Brien, who developed and led the Quark Consumer Advisory Group from the beginning of the centre. And it's since been led and further developed by QARC as part of the stakeholder engagement portfolio. So to develop a centre that one of our objectives is to meet the needs of people with aphasia, then we really need to make sure that they're central to all of our activities. And there's many good reasons for this. It's ethically the best way to do research, but it also makes our research more useful, more acceptable, and also more accessible for those living with aphasia. It also means that it's more likely to be implemented into practice. So at the centre, people living with aphasia are involved in governance, they're involved in advocacy activities within and across different research projects, and also in the development of theory and the evidence base regarding consumer involvement. So at the governance level of the centre, we have a consumer advisory group, which includes people living with aphasia and family members. And so they've guided our priorities, our activities, and how we actually do things, so our operations. So this group ensures that the voice of consumers is central to all that we do, and they keep us accountable. And this has been, I think, something that I've valued considerably. In the way that they can detect, as researchers, sometimes we may get a bit carried away with or obsessed with a particular idea, thinking it's great, but they have consumers within this group have made sure that things might be questioned as to whether they are the appropriate thing to do or not. And I think this has been incredibly valuable. On the advice of the consumer advisory group, we've also, to make sure that things are applied clinically, developed a clinical advisory group, or a CLAG. And so this includes clinicians across Queensland who work in various different stages of care in public and private spheres. And it also sits at this governance level, so it mirrors what the consumer advisory group is doing. So at the centre, people living with aphasia have been included in all stages of the research process. So from the initiation of projects and research ideas, consultation through to partnership. So consumers are investigators on grants and employees within the centre. And while this might seem obvious, it happens actually all too rarely or all too late in the research process. So involving people with aphasia in this way, we need to make sure that we have communication supports in place to ensure that it's meaningful engagement. And this takes time and money and resourcing and training. And it also requires a really strong commitment from the people with aphasia and their families. So they're giving incredibly generously of their time in what can be a very vulnerable stage. And additionally, we as researchers also need to then be open to be questioned about the relevance or importance of what we're doing, or how acceptable it is as a research idea, or the way that we're researching it. But by taking this partnered approach to building knowledge, we're able to then reduce research wastage and treatments that are less likely to be implemented into practice. So for me, I think this has been an incredible eye-opener, this development over the last 3 to 4 years. And I think it's really had a meaningful impact on the way that the centre is operating. So coming back to the recent evaluation of international centres, a number of factors were identified as contributing to positive outcomes for centres. And so these included the type and nature of the services and programs offered. So purposeful services that were innovative, that allowed for new experiences, that met people's goals, were highlighted as integral to positive outcomes for centres. Also, the environment and the social atmosphere was noted. So a social community atmosphere was reported to empower members, to make them feel supported and valued. Thirdly, the opportunity to build social connections was really important. So that the centre enables or builds on this capacity, and this was seen as contributing to service effectiveness. So this includes establishing a community network and making sure that people are included and they're able to share their lived experiences. And finally, service accessibility was also a priority, both physically, but also in terms of financial accessibility and feasibility for members to attend. And finally, various centres used a range of ways to evaluate service outcomes so that they were continuously adapting and adopting different ways to improve their services to meet members' needs. So at QARC, in terms of these positive attributes that were seen to lead to positive outcomes, some of what we have been doing, you could see, is consistent with these factors. So in particular, the types of services provided, so through this commitment of the STARS Speech Pathology Department in being able to then deliver a comprehensive high-dose aphasia treatment. So this has been, the research here at STARS has been led by Jade Dignam. And in terms of innovative programs that then enable more access, we have the online sibling, TeleChat, which has been led by Annie Hill. So this fits with the idea that for centres, there are these positive outcomes if they're developing and delivering innovative, high quality, and by this I mean evidence-based programs that have strong outcomes and that are aligned to people's goals. In terms of social connections, we've also been establishing a Quark coffee group. This has been led by Sally Zingelman and Sonia Brownsett, and many staff members and students. And this has two formats, so it's been both online during hospital restrictions, but also in person. The really nice thing about it has also enabled, or it's been linked in with drop-in sessions at the Aphasia Tech Hub that I'll talk about in a minute, and also has formed a way that people who are undertaking the chat program can then be linked in with community networks as part of the coffee group. Another feature of Quark that builds these social connections and allows innovation is the Aphasia Tech Hub. So this was developed from scratch by the late Jess Campbell, whose vision in creating the hub is something that we are still following and wanting to achieve. This is one of my favorite photos of Jess, who I can imagine laughing very loudly at this point. So one of Jess's many great ideas was to work with Phil and Kim, who are seen here, who both have aphasia and work at the centre in paid positions. So they are involved in developing resources, providing advice, and working on aphasia accessible tech solutions. So the Tech Hub is now led by Sonia Brownsett and also involves Corey Ramaju, in addition to Phil and Kim. And so the aims of the Tech Hub are to provide services. So this might be individual, might be consultations, might be workshops and seminars. The key thing is that these activities enable people with aphasia to access appropriate technology that can then improve or increase self-management and self-led rehab and increased independence. So there's a drop-in service and an online service that we are looking at further developing, in addition to education provision on how particular forms of technology can be used, so targeting people with aphasia, and then also supporting this advocacy role so that advocating for people with aphasia to be able to access and use technology that will improve their lives. And it provides this social space where they can obtain advice and share knowledge and support as well. Another key focus for the Tech Hub in the next phase of the centre is looking at ways to then increase this access and these supports for people in rural and remote regions. So getting back to Bob. So clearly, if you read this, you could interpret that he could be, and I'm probably interpreting this slightly in a biased way, reflecting on myself, he could be talking about TikTok and parenting and generative AI here. So I'm going to take that leap and then talk a little bit more about technology. And so I suppose the main theme is change and how rapid that has been outside of aphasia therapy in many ways. So meanwhile, what we're doing clinically has not kept pace with some of these advances, particularly in the last 5 years. And so the Tech Hub, one of its remits is to keep up with these rapid developments through partnerships. So a really exciting example of this is just today and tomorrow, Quark is one of 4 organizations selected to be part of an Amazon hackathon, Hack for Purpose, which commenced this morning. And there's an amazing sense of energy and purpose in the room with 60 plus, I want to say nerds in a very positive way, all thinking about solutions to enable better communication. And as an example of this, in just a couple of days for another activity, there's this demonstration of developing a language learning model that can look at a video of someone with aphasia giving a speech sample, transcribe, code, classify, and write a summary report. And of course, it's not 100%, but it is an incredibly compelling, very good first stab at this in an incredibly amazing, efficient way that I think it then is incumbent upon us to then be working with this technology to identify how we can be harnessing it for clinical purposes. So this work has built on the tech quest that Jess developed and was worked on with Corey Ramaju and Pete Worthy. And this has really identified design considerations for people with aphasia when wanting and needing technology. And so it's really important to have that input early on. So in terms of metrics, the centre's been very productive across, and it's really exciting to see in terms of our objectives for people accessing services, high doses of therapy, lots of clinician and researcher engagement opportunities, and consumer engagement opportunities as well, and a large network of collaborating organisations. The other thing we are looking at as well clearly is impact and other forms of impact. And the road to this impact is often long and winding, but I think we have had some early wins in the centre, particularly relating to our partnerships that are both local and national. So you can see in terms of short-term impact, there are areas where I think we've made some gains, also some in midterm, and in terms of our opportunity by being co-located and in partnership with the STARS Health Service has allowed some headway to be made in terms of making services more accessible. And interestingly, as part of a centre with philanthropic support, that was one of the key features of this support was around for people with aphasia. The donors wanted to see what the impact was across, so not just publications, but across these other metrics. So we're getting to the end of the song now. So Bob is ramping up and about change that is imminent. So I would argue that in a relatively short amount of time, we have managed to make some changes for the better, but there are always stubborn big questions or answers that should not be blowing in the wind that I think we still need to tackle. And this has been raised a number of times within the centre. So one of the key ones is, how do we raise awareness of aphasia and advocate for improved services and supports? An example of how at the centre we've been doing this, I'd really like to call out the efforts of Emma Caird, who's the centre manager and leads our marketing and publicity work, and Margot Sexton for administrative support in making the most of opportunities in the news where there is this potential to be raising awareness of aphasia, where recently there was quite a lot of coverage. I'd like to say it broke the internet, probably not that far. But the other thing that we've managed to do is to be able to make the most of opportunities to be speaking to people in policy, senior policy positions. So as part of the NHMRC Award for Consumer Engagement, we had the opportunity to present to state and Commonwealth Health Chief Health Officers, the NHMRC Council and CEO, and also the Honourable Mark Butler, Federal Minister for Health and Ageing, who you can see here. I am hypnotising with my presentation. one of the next steps in terms of this area, I think it's really exciting, the work of Claire Bennington and her team as part of a PhD, which is looking at systematically looking at how we can raise awareness of aphasia. So what are the mechanisms and how can we maximize this? So the other stubborn big questions that we're still seeking is, what will the outcome be for my family, me? What treatment and support should I get? And what treatment and support can I get? And so I think we're getting closer to identifying what should be provided. And the centre has provided some opportunities to do this and to think larger. But I think it's then this next step of looking at what can be provided. And Rebecca Palmer has a quote here that kind of captures this very difficult conundrum where we have a scarcity of resources, but we have significant unmet need. So when resources are in short supply, therapists have the difficult ethical decision of providing therapeutic levels of intervention to some patients or providing subtherapeutic levels to all. So in order to act on this, then what we would need is accurate clinical predictors of the types of therapies that we know people will be needing, so including comprehensive high-dose treatments that could then identify for an individual how much and what type of treatment is required for enduring effects. So across the different activities of the centre, we've been looking at these predictors as well, but we've been able to look at a larger scale at things like ICAPs, so comprehensive aphasia programs that do give a significant dose of treatment. There's other work within the centre looking at how do we actually measure outcomes in a meaningful way? How do we measure what care is provided? And then looking at the mechanisms. So are there markers of brain health premorbidly, or lesion size and location, or interactions and connectivity that can enable this better prediction of what might be the outcome of these type of treatments? Clearly, there has been a focus on this, but there is a very large piece around psychosocial factors that often drive recovery. And so there's been an emphasis within this prediction work around language recovery and neurobiology. And some progress has been made in this, particularly metrics of disconnectivity, that has been led by Sonia. But as with everything, what seems pretty bloody complex, even if we just constrain ourselves to thinking about language, then gets much more complicated thinking more broadly as we need to. So this has been eloquently put here by late Audrey Holland, who, as always, was incredibly wise here and points to some ways forward. So just highlighting that the range and degree of adaptation, accommodation are at least as infinite as this range of language manifestations we have with recovery, but there appears to be a little relationship between or among language impairments and the coping. So some people with mild aphasias, supportive families, and excellent and appropriate intervention remain devastated. Some people with much more severe aphasias, questionable or absent support, and minimal interventions manage to fit aphasia in and to some extent overcome it. So what goes on here? And how can this not be a question to fuel one's fascination? Indeed. So in terms of our next steps within the centre, I think this is another area where I think I can see it as the extension of our earlier work on developing programs that meet some of these needs in terms of dose and comprehensiveness, but then thinking more comprehensively about the different factors that might drive adjustment and management and recovery. And so one key point there, I can see that for the centre will be leveraging these convergences. So looking at these different measures that we have been taking, but then applying them across our different programs to look at how we're measuring care and outcomes and what we can predict more broadly than just language and recovery. There'll also be project-driven activities from MRFF, NHMRC and philanthropic funding. I think there's an incredible unmet need for people with aphasia in other populations, so including those with epilepsy, dementia, and adults with brain tumours. And I think another key step for us is to then consolidate what we have done in terms of these newer treatments, but think about how we scale them up and implement them. And if we're looking at supports, how we then embed them and make them sustainable. So thinking about Audrey Holland's words, we then need to think more about predicting not just recovery and treatment response, but support needs and adaptation. And to be doing this by improving how we measure these factors and outcomes. To focus on promoting recovery and quality of life through developing these interventions and supports, but also thinking about self-management and how we harness this capacity in the community, and focusing again on some of these incredibly negative consequences and outcomes of aphasia for people within health services and at home. The other great thing that we have in terms of thinking about next steps for the centre is the work of the newly minted Dr. Lisa Animat as part of her PhD with Vicky Palmer and Sarah Wallace and myself, which is the Aphasia Service Co-Design Project. So Lisa collected experiences and priorities from 151 participants throughout Queensland, ran consensus groups and surveys, and then identified priorities for change. So there were a large number of priorities identified by speech pathologists, people with aphasia, and family and friends. But what this can do for us is identify what these unmet needs are that we're not currently addressing. And in particular, what emerged is that these will vary predictably depending on location. So for regional and remote people, and also for different populations that are coming into these services. So this will drive our priorities going forward for the centre and what we're focused on. So the final piece of research on aphasia centres that Bridget and Lisa and Sarah have been conducting looks at what are the factors that might be seen to contribute to sustainability. And so the top three for these were the service providers, so the passion amongst staff, volunteers, members and trustees, that financial piece, so that there's some combination of different funding from different sources, and that clients are at the centre of what is delivered. It's also a clear focus on building community networks and how this is done in terms of communication, to be constantly measuring sustainability, and then also this idea that sustainability needs to be managed through various large upheavals such as occurred through COVID-19. So the ability to transfer quickly and adapt was seen as an important component for sustainability. So considering these factors that are seen to contribute to this holy grail of sustainability, I'd argue that we are well positioned. So the dedication and passion of people living with aphasia, clinicians, researchers, students and staff, and our partnerships, and focusing on the voice of people living with aphasia in all that we do. So looking across aphasia centres more broadly, I think they can provide these unique opportunities to be aspirational and to accelerate changes in practice and training and outcomes. But the key next step is then considering how this can be sustained and implemented more broadly. And this will be a key driver in the next phase of the Queensland Aphasia Research Centre. I'd like to very quickly plug something. This presentation is brought to you by QARC 2024. So this will be in Brisbane next year. Brisbane, in summer, the heat might kill you, but in July, it is delightful. So please look at that. And it's a really great opportunity to be meeting with people with aphasia and clinicians and researchers. And finally, I'd like to thank all the team and our partners and collaborators, our consumer and clinical advisory groups and steering groups, and our funders and supporters. And I'd like in particular to thank all the people living with aphasia who've been involved in this work from the start and have given so much to make the centre what it is. Thank you.
Wonderful. Thank you so much, Dave. It's always nice to hear a summary of all of the achievements that Quark's had since we started. And I have to say, I'm very impressed, not just that you managed to weave it into the title, the Bob Dylan quote, but throughout in a very meaningful way. So well done on that one. There's a few questions in the Q&A. I just want to start off with my own though. Can you give us your top highlights of the last 4 years? And what do you think the biggest challenges moving forward are going to be for us?
So I think the top highlight would be the working with people living with aphasia, which for me has been a significant, quite a transformative way of thinking about what we should be researching and how we should research. So I think that would be my number one pick if I had to.
I have to agree with you there.
And significant challenges, I think, and this is not a surprise, but sustainability in both financial terms, but also commitment and security for staff and students. And I think it has been an incredible amount of work that everyone has put in. And so thinking about that, in addition to the ongoing financial constraints, not just within research, but within health services, I think that's one of the key challenges.
Oh, thank you. Okay, moving on to the Q&A question. So we've got an anonymous attendee who asks, that's almost like it's been planted. I heard that Quark received the 2023 NHMRC Consumer Engagement Award. Could you tell us a bit about why Quark received this award?
Thank you. Yes, that was, I didn't want to blow our trumpet too much about that, but it was very exciting. So this is an award that it's only been running for a few years, and it is to recognise consumer engagement and community involvement in research. So in previous years, it has gone to individuals. So this is the first time that it has come to a centre. I think we were recognised because of the breadth of consumer engagement across all the different phases of research. So including at that governance level and individual research projects and then beyond. I think that kind of made us stand out quite a lot relative to some other organisations. So yeah, it was incredibly surprising in some ways, but also very validating to get that recognition, and also to then be able to demonstrate some of the activities that we're doing as a centre, and to identify, I think when talking to other research groups at that award ceremony, it was clear that there was an awareness of the need for it, but still early days in terms of meaningful consumer engagement.
Yeah, I agree. I think that was a highlight for the team as well. Linda Worrell has asked, how do you see the nexus between being an aphasia centre, i.e. service delivery, versus being an aphasia research centre? Which drives which?
And excellent question. So I would, and this is probably one of the differences with our centre compared to some of the other ones in that international survey, is that our remit is primarily for research that drives improved services. And so clearly a focus then will be on supporting clinicians in the implementation, supporting people with aphasia in developing new supports that enable them to be more independent. So I would see it as it's iterative and cyclical, but I think it's actually a huge advantage if we can be using research that's very much focused on that implementation as a focus, that then through partnerships with health services, we can get more change more rapidly.
And then Sam Harvey, also from Quark, says, given that there are a number of large centres making high quality contributions globally, what do you see as the future of global partnership between these centres? Is there an appetite and a way to pool resources?
So I would actually think there would be some benefits in looking at, and again, this is why the research project around international aphasia centres is, I think, a great basis for starting to think about this. So rather than everyone reinventing the wheel, identifying the key challenges and what has worked, and again, particularly around what were the factors that drove positive outcomes, but also what have been the major challenges that have led to some centres not progressing or really struggling. So to use that knowledge and to share that knowledge across centres to make them more sustainable, I think makes a lot of sense.
Okay, and last question we've got so far. Linda again saying, come gather around people wherever you roam. Another Bob fan. How can we gather people around Quark to help with philanthropic funding?
So you can join the Quark affiliate list would be one way to do that. Not that this is an advert, but that's a way to keep up with activities within the centre. I think we benefit quite a lot from I think the marketing work of Emma Caird that she has led. I think what we're keen to do is to then have supporters of Quark who can then link in with other community and business organisations. So to Linda's question, I think that capacity to kind of get out of our bubble and to be spreading the word, and I think that will help in terms of further support in the future.
Brilliant, thank you. And that's a perfect note to end on, I think. So thank you very much, Dave. That's a lovely seminar that we've had. Just to introduce our next seminar for next month. So this is going to be from Dr. Kirstine Shrubshaw, who will be presenting on implementing evidence into practice in aphasia services, priorities and practical steps. Now, this seminar is going to take place on Wednesday, the 22nd of November. But do follow us on Twitter and via our community of practice for details of how to register. See you then. Thanks for joining us.